Hello class, my name is Ricky Jackson. I'll be discussing my case study and lit review, which was on childhood diabetes type 2. I also have here Javon Jackson, who will be my patient today. A little background on the case study and lit review. The reports indicate that as many as 45% of pediatric patients diagnosed with diabetes in the United States have type 2 diabetes. 1 to 2% of children diagnosed with diabetes in the United States have type 2 diabetes. Children with type 2 diabetes are often obese. As many as 80% are overweight at the time of diagnosis. Having a nutritionist provide counseling for care along with pediatricians can provide critical care. Children with known risk factors, screening is recommended at 10 years of age or at the onset of puberty, whichever occurs earlier, and repeated every 2 years. So, once again, what's your name?
My name's Javon Jackson.
How are you?
Good.
Glad you come in today. I'm glad you came in because we ran some tests on you, and it came back that you are have type 2 diabetes. With that diagnosis, do you have any questions or concerns before we go any further?
What is type 2 diabetes?
Oh, great question. So, type 2 diabetes is when your body doesn't use insulin properly. In type 2 diabetes, some people are insulin resistant, meaning that their body produces a lot of insulin but can't use it effectively. Some people with type 2 diabetes don't produce enough insulin. Type 2 is different from type 1 because in type 1 your body doesn't produce any insulin at all. So in your case, how active are you at home?
I don't really do anything. I'm on the computer most of the day. That's all I do.
So not very active outside.
No.
Do you feel do you feel sick at times?
I do feel a bit tired than usual. Just lazy, lounging around. I don't know if that's common in type 2 diabetes, but
Have you seen your weight go up?
yes.
Okay. Well, there's a couple things here we could talk about. And some of the symptoms for diabetes are fatigue, which you kind of alluded to here, and that happens when you're not active outside or playing any sport, especially as a young kid. And your age is, what's your age again?
I'm 14.
14 years old. So that age, kids are usually active, right? Extreme thirst. Do you have any issues with extreme thirst at times?
No, not that I've recalled.
Okay. It says here extreme hunger.
Yes, I feel like that has happened on
Okay.
occasion.
All right. What about blurry vision at times? Maybe moving around and.
I do get pretty motion sickness if I move around too much.
Okay. All right. You have any other questions?
What causes type 2 diabetes?
That's another great question. So, type 2 diabetes has several causes, right? Genetics and lifestyle are the most important ones. A combination of these factors can cause insulin resistance. So, your genetics, do you know anyone in your family that may have diabetes?
Yeah, my grandfather, he has type 2, he has diabetes. He had to get both his legs amputated.
Oh, wow. So they also say that, it's more likely for African Americans and Asian American, and your nationality is what?
Asian African American.
Oh, so you're both of those. So very high risk to get diabetes as well. And when you're not very active and not doing things to be healthy, those things can really contribute to you not being healthy. right? So how's your grandfather? Like, is he doing well?
In timing, yes. Just guys both his legs cut off because of diabetes.
He takes his insulin.
He takes his insulin, takes his meds
Okay.
every day.
All right. Great. Do you have any other questions before I kind of go into some things that I want you to kind of look at for your health?
Yeah. What are some of the risk factors of type 2 diabetes?
So some of the risk factors, like we talked about, is family history, which you told me that your grandfather is a diabetic, right? The race and ethnicity, right? You kind of told me about that. And age usually is, type 2 is usually in older people, but as you hear that it's becoming more common in kids that are obese. So we got to look at some things that's going to get you on a good plan to get you back healthy. Okay.
Okay.
All right. So let's transition and talk about some things we're going to do to get you back healthy. Okay. So here I have a what I call our SMART plan. Okay. This is all about you, Javon. Right. So we're going to look at some specific goals, some things we can measure, attitude, right, and some things you can achieve with that. Some attainable things you can get after, and some realistic things, and then how we're going to look at that with our time when we're going to do these things, right? And I always say, hey, any issues that you have, you got to talk to your healthcare professionals, okay? All right. So some specific goals that I think we could do as far as taking your medication. I think that's the first thing you got to look at, right? Who's responsible for taking medication?
Myself.
Yourself, right? And you have parents that can kind of help you, coach you along, make sure you're doing that, right? So you gotta, like, what do you want to accomplish here?
I just don't want to. I just want to get outside and run.
Right, and you want to beat diabetes, right?
So.
All right, okay. Like, where will you take your meds? Home or at school?
Home.
At home, yeah, that's good, and your parents can help monitor that. Okay. What do you think would be a problem? Like, would there be any issues with you not taking your medication?
I don't think so.
Okay. Not forgetting, like playing your games or something like that, because you just got to have some responsibility here. All right.
Like you said, my parents will coach me along.
Okay.
Sure.
Okay. And of course, I always say why. Why are you taking your meds? Right, and that's to get better, right?
Yes, sir.
Okay. All right. Some measurable things, right? What do you think? Some things you can do, like writing goals down, right? What goals you think you could do with taking your medication and getting healthy?
Trying to be more active.
More active, right?
Yes.
Okay. And having some clear and concise, things that you can actually do, like writing it in a book, having it on a refrigerator, your times when you need to take your medication, right? And how often, right? Okay, great. And then attitude, I think is big, right? So like working out, even if that's walking up the street or back or getting outside playing with friends, you got to do it, okay? All right. And then you got to identify some goals that are most important to you. And most important to you is living, right? Okay. And taking your medication, all right? All right. And then realistic. What do you think is realistic? Tell me what you think is realistic about taking your medication and getting healthy.
Help me get better. Won't cut my life short if I don't take them. And honestly, I just want to be here for live long enough to see my family.
Okay, good. And you got to set goals, whether that's a week. You have a goal to do well in a week, and then baby steps to get to a month. Okay. All right. And then, having been diagnosed with type 2 diabetes, it's about healthy balance, lifestyle, such as eating, maintaining a good weight, and exercising. Okay? But you're going to do well. You're going to be okay. Diabetes is not the end-all, be-all. It's all about Javon. Okay?
Okay.
All right. Well, thanks for coming in today.
Thank you.
Thank you.